In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For examples 25 to 30, choose the best answer, A, B, or C, which fits best according to what you hear. For you will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now look at question 25. You hear a discussion between 2 doctors about the complications which are expected at a later stage following heart attack.
Hello, doctor. What types of complications are expected at a later stage following a heart attack?
Well, there are certain complications that arise at a later stage following heart attack. In the condition called aneurysm, a scar tissue builds up on the damaged heart wall, resulting in blood clots, low blood pressure, and abnormal heart rhythms. In the condition called pericarditis, the lining of the heart becomes inflamed, causing serious chest pain. Angina occurs when there is not adequate oxygen to reach to the heart, causing chest pain. During congestive heart failure, the heart beats very weakly, leaving a person feeling exhausted and breathless. In the condition called edema, fluid accumulates in the legs and ankles, causing them to swell. Loss of erectile function is caused by a vascular problem. Loss of libido or loss of sexual drive happens, especially in the case of men. Question 26. You hear a discussion between a doctor and a nurse about uterine fibroids.
Hello, doctor. What are uterine fibroids?
Well, uterine fibroids are benign tumors that may grow in various parts of the uterus of a woman. Intramural fibroids are the most common type of fibroid that appear within the muscular wall of the uterus. Intramural fibroids can grow larger and stretch the womb. Subserosal fibroids form on the outside of the uterus called the serosa, and may grow large enough to make the womb appear bigger on one side. Submucosal fibroids bulge into the uterine cavity. Pedunculated fibroids are attached to the uterine wall by a stalk-like growth called a peduncle, which is the main difference between pedunculated fibroids and other fibroids. If a pedunculated fibroid forms in the middle muscle layer or myometrium of the uterus, then it is called pedunculated submucosal fibroid, and if it forms outside the uterus, it is called a pedunculated subserosal fibroid. Question 27. You hear a discussion between a doctor and a nurse about acquired digital fibrokeratoma.
Hello, doctor. What is acquired digital fibrokeratoma?
Well, an acquired digital fibrokeratoma is a benign tumor usually occurring on the fingers and toes, which is an uncommon condition often seen in middle-aged people. Usually the tumors have a dome-shaped appearance, but can also look like elongated projections in some cases. Acquired digital fibrokeratoma lesions are usually isolated, but are also associated with other tumors, in very rare cases. A type 1 acquired digital fibrokeratoma lesion is dome-shaped and has a dermal core that is made up of a thick, intertwined bundles of collagen, which are typically oriented along the lesion's vertical axis. There are numerous capillaries, thin elastic fibers, and fibroblasts between the bundles of collagen. The type 2 acquired digital fibrokeratoma lesions are less common. Although they appear similar to type 1 tumors, histologically, they are typically tall and also have a considerably higher number of fibroblasts and fewer elastic fibers. A type 3 acquired digital fibrokeratoma is very rare, and the tumors are fluid-filled and have fewer elastic fibers. The lesions can be flat to dome-shaped. Question 28. You hear a discussion between a doctor and a nurse about pelvic organ prolapse.
Doctor, what is pelvic organ prolapse?
Well, pelvic organ prolapse refers to the condition in which one or more of the pelvic organs suffers descent from their normal position in the pelvis. It may be congenital, or acquired defect, or weakness in the normal pelvic supporting structures. The anatomical categorization describes which organ is primarily involved in the descent. Urethral involves the anterior vaginal wall, and urethra descend into the vaginal opening. Cystocele involves descent of the anterior vaginal wall and bladder. Cystourethral involves the prolapse of the bladder and urethra along the anterior vaginal wall. Uterovaginal prolapse involves the descent of the uterus, the cervix, and the vaginal vault. Enterocele prolapse of the posterior uppermost part of the vagina with loops of small intestine that have accumulated inside. Rectocele involves descent of the lower posterior wall of the vagina and the rectum which bulges into it. Question 29. You hear a discussion about hematuria.
Hello, doctor. What is hematuria?
Well, hematuria is a health condition that is identified by the presence of blood in the urine. Microscopic and macroscopic are the two major classifications of hematuria. The different types of hematuria categorized based on the cause are: infective hematuria is caused due to pyelonephritis, cystitis, or urethritis. Stones-related hematuria is caused due to staghorn calculi, calcium stones, or uric acid stones. Trauma-related hematuria is caused due to pelvic trauma, renal injuries, or foreign bodies. Renal hematuria is caused due to immunoglobulin A nephropathy, hereditary nephritis, medullary sponge kidney, or thin basement membrane diseases. Latrogenic hematuria is caused due to recent endoscopic procedure, transrectal ultrasound, traumatic catheterization, radiation, indwelling ureteric stents, renal biopsy, extracorporeal shockwave lithotripsy. Benign hematuria is caused due to strictures, renal masses, or benign prostatic hypertrophy. Malignant hematuria is caused due to prostate acinar adenocarcinoma, or renal cell, transitional cell, squamous cell, or urothelial cell carcinoma. Question 30. You hear a discussion about types of collagen and associated disorders.
Doctor, can you explain different types of collagen and associated disorders?
Well, there are about 29 genetically distinct collagens present in animal tissues. Collagen types 1, 2, 3, 5, and 11 self-assemble into D-periodic cross-striated fibrils. Here, the D is about 67 nanometers, and there is characteristic axial periodicity of collagen. Type 1 collagen is found throughout the body except in cartilaginous tissues. It is the main component of bone. It is also synthesized in response to injury and in fibrous nodules and fibrous diseases. Type 2 collagen is the main component of cartilage. It is also found in developing cornea and vitreous humor. These are formed from 2 or more collagens or copolymers rather than a single type of collagen. Type 3 collagen is found in the walls of arteries and other hollow organs and usually occurs in the same fibril with type 1 collagen. Type 4 forms the basis of cell basement membrane. Type 5 collagen and type 11 collagen are minor components of tissue and occurs fibrils with type 1 and type 2 collagen respectively. Type 5 forms cell surfaces, hair, and placenta. That is the end of Part B.